HIV/AIDS, pathogen or disorder. The term AIDS stands for Acquired Immunodeficiency Syndrome, and it is a condition caused by the HIV virus. The difference between these two terms is the fact that people can have HIV without developing AIDS, but if you have AIDS, you must have been infected with HIV. HIV attacks the body's immune system, specifically the CD4 cells or T cells, which help the immune system fight off infections. If left untreated, HIV reduces the number of CD4 cells in the body, making the person more likely to get infections or infection-related cancers. Over time, HIV can destroy so many of the cells that the body can't fight off infections and disease anymore. Symptoms. You cannot rely on symptoms to tell whether you have HIV or not. The only way to know for sure if you have it is to get tested. The symptoms of HIV vary, depending on the individual and what stage of the disease you are in: the early stage, the clinical latency stage, or AIDS stage. Early stage. Symptoms related to acute HIV infection, when a person is first infected, can be similar to the flu or other viral illnesses. They include fever and muscle pains, headache, sore throat, night sweats, mouth sores including yeast infection, swollen lymph glands, and diarrhea. Many people have no symptoms when they are first infected with HIV. Clinical latency. After the early stage of HIV infection, the disease moves into a stage called the clinical latency stage, also called chronic HIV infection. During this stage, HIV is still active but reproduces at very low levels. Also, this stage can last up to decades. AIDS. Finally, if the disease is not treated, it makes its progression to AIDS, the last stage. Someone with AIDS has an average time of 3 years of life until the disease kills him. Some symptoms of the progression into AIDS are these: rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, pneumonia, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurologic disorders. Prevention. HIV is transmitted through bodily fluids such as blood, semen, fluids from the vagina, and breast milk. Therefore, to prevent its infection, you must get tested, do not use illegal drugs, and do not share needles or syringes, avoid contact with another person's blood. If you test positive for HIV, you should not donate blood, plasma, body organs, or sperm. HIV-positive women who might become pregnant should talk to their provider about the risk to their unborn child. Breastfeeding should be avoided to prevent passing HIV to infants through breast milk. Safer sex practices. Even though there is still a risk of getting the infection, abstinence is the only sure way to prevent sexual transmission of HIV. Treatment. HIV/AIDS is treated with medicines that stop the virus from multiplying. This treatment is called antiretroviral therapy, ART. Regular blood tests are needed to make sure the virus level in the blood, viral load, is kept low or suppressed. The goal of treatment is to lower the HIV virus in the blood to a level that is so low that the test can detect it. This is called an undetectable viral load. If the CD4 count already dropped before treatment was started, it will usually slowly go up. HIV complications often disappear as the immune system recovers.